We believe people with autism are truly amazing. Please mute your microphones, keep cameras off during the conversation, and use the chat to share questions or reflections as we go. We'll open live Q&A towards the end, and you are also welcome to email follow-up questions anytime at amazingkidsautism@gmail.com. Let's begin. I'm Simone Olson, co-founder of Amazing Kids. Today's conversation is called What to Expect When You're Expecting an Autism Diagnosis. And we chose that title very intentionally because when parents start to suspect autism, they're not just asking what is autism, they're asking what does this mean for my child's future? Did I miss something? Am I about to lose the life I imagined for my child? Today is not about fear, it is about clarity. We're going to talk about why the label of autism often creates grief, why the same label is often the fastest path to success, and why early diagnosis is so often the difference between independence and failure to launch. I'm joined by my co-founder, Dr. Jennifer Hensley, a pediatric nurse practitioner with over 20 years of experience supporting children with autism and leading multidisciplinary diagnostic teams, both inside traditional healthcare systems and through evidence-based virtual models. Welcome, Dr. Hensley.
Thank you, Simone. Good afternoon, everybody. First, I always just want to start by thank you for allowing us to be a part of your child's team. I'm big on teamwork and collaboration, and it's important for you to pick the right team members for your child's team. So if you're here, you're probably carrying a lot of questions, some uncertainty, and maybe even a little bit of quiet worry. So our goal today is not to rush you, but to help you understand what a good diagnosis actually does for a child and a family. And don't you just love that title? I hear that title, What to Expect When You're Expecting, and it just warms my heart. I read that book for my first kiddo at least, but I feel the same way about an autism diagnosis. It warms my heart. Children with autism, people with autism are amazing. And autism doesn't mean the end of possibility. In many cases, it really truly means the beginning of momentum. So welcome, and I'm glad to see everybody today.
So let's begin with the diagnosis, why the label hurts and why it is critical. Dr. Hensley, let's start with the emotional reality. For many parents, the word autism creates real grief. It can feel like a loss of the future they imagined for their child. Why does the label feel so heavy at first? And then so many families later say that getting the diagnosis was one of the most important decisions they made.
It's very true, Simone. It's very heavy and overwhelming and emotional, and it's complex, it's layered, and it's not linear. We're not going from A to B. Even when that diagnosis brings clarity, it can still carry significant emotional weight for a family. So I just kind of want to go over some just common emotional experiences with a diagnosis. So the grieving process, I'm sure everybody's heard of the grieving process. Shock, disbelief, grief, relief, guilt, blame. Kind of want to go through some of those in a little bit more detail. So shock and disbelief can come along when a parent really wasn't expecting that formal diagnosis. Grief, not necessarily grief for the child themselves, but for the imagined future that they held. Those milestones or lack of milestones, the ease of life, the challenge of life, and the societal acceptance can all cause grief. Relief. I have a lot of families that say, oh, thank goodness, I'm not crazy. I knew something was wrong with my child. And the imagined future that they held will also kind of wrap in there when we're feeling relief of like, okay, we got this diagnosis and it's going to open some doors and services and supports. Guilt, blame, self-blame. What did I do wrong? What could I have done different? Questioning, I missed the signs. Or did I actually cause this autism? Fear and uncertainty about the child's long-term independence, relationships, and what's their quality of life going to be like? Will they be independent someday? Parents can feel overwhelmed, suddenly faced with like navigating a myriad of health professionals, therapies, medical systems, advocating, special education. And then it's very common for parents to go into a protective role, emerging as these parents just wanting to take your babies and bring them in close, tight, and protect them from the world. And so many parents can kind of describe this process as a roller coaster or a lot of emotional oscillation, moving back and forth between hope and grief, confidence and doubt. And importantly, these feelings really can resurface at any time. So there's not a single right, or I quote that loosely, a right reaction. And it's important to know that acceptance is not a moment, but it's truly a process. An emotional adjustment is going to occur throughout this process, but it really is a process. I hate when parents feel judged or blamed, but it's typical for them to feel misunderstood. And, and I hate this also that some people will say, well, it's just the parenting style. You have to parent different. And that really, unfortunately, leads to a lot of isolation for parents. And so over time, most parents, I would say, really realize that naming the diagnosis reduces the stigma. Now we can own this diagnosis, educate ourselves about the diagnosis, and normalize this amazing neurodiverse diagnosis. So, the challenging stigma is not just about changing the public perception, but it's also about helping families feel supported and seen and respected and not judged. So, we see you, parents, we hear you, and we're here for you.
Thanks for that. You often say that diagnosis doesn't limit a child, it unlocks them. Can you explain how having the right diagnosis actually accelerates independence rather than holding a child back?
Yeah, this is the method behind all of my treatment plans is independence. So just as any other child, and I know last week we talked about independence for children with autism, like any other child, my goal for your child is independence. And so that timely evidence-based evaluation and intervention is going to be the catalyst to improve social communication, language, adaptive behavior, and reduce those core autism symptoms that truly dominate your child and prevent them from assimilating. And so it's important for us to also consider that this diagnosis will reduce family stress and truly improve long-term quality of life. And again, what's the goal? Independence, right? So just to kind of drill down a little bit deeper. So early intervention is an amazing services. Every county across the country has early intervention services that you can access. You don't need a medical referral to access early intervention services, and your tax dollars pay for this. And so early intervention is an organization that comes into the home to work one-on-one with the child in the child's natural environment. So we hope to, in the future, in the upcoming months, we're going to have some back and forth kind of fireside chats with colleagues, and early intervention will be one of those. And so, with that early intervention, social communication is going to improve. We're going to have that early language and adaptive skills are going to improve, and we're going to reduce the symptom severity again. Lowering the severity of those symptoms again will allow the child to go through typical development stages as they're going to need to go through. Family and societal stress, again, these beliefs cause more stress on the family. And so we want to reduce that by educating society and educating the family on this is really and truly an amazing diagnosis. And so we want to make sure that we are, entertaining that as well. And then we're going to talk about this in a little bit more detail in a follow-up question, but that early diagnostic evaluation and the diagnosis is critical because that early brain development is so plastic from ages 2 to 3 that we really want to get these children into services as quickly as possible so that we can capitalize on all that activity going on in the brain at that young age.
So, one of the hardest truths we talk about with families is this: without diagnosis and support, many children develop more autism symptoms as they grow older. Can you explain what we mean when we say early diagnosis can be the difference between independence and failure to launch?
Yeah, so, basically what happens when these needs go unidentified and what happens when we miss support over time. And, without making sure that we are giving the child the tools that they need, that goal of independence is potentially going to get further and further away from us. So, independence is the primary goal. I want all children to function at the top of their ability to be as independent as possible. And that's going to maximize our long-term quality of life by enabling your children to participate in activities, sports, soccer teams, art clubs, whatever they want to do, band, get educated to the top of their ability. This is where I see a big struggle for most families because as children with autism get older, those autism core symptoms can become more and more dominant. And when you're in an educational system and your behaviors are a struggle, it's really hard for those teachers to educate that child to the full capacity that they're capable of. And so education is where we're going to see a big hit if we're not properly diagnosed and with the proper interventions. Employment. I've unfortunately had lots of patients, brilliant patients, but employment is hard for them if they're not interpreting the social environment. They're not able to interpret when customers need something or when their boss is telling them that they need to do something different than what they're doing. And then just integrating into the community, into clubs or organizations, this can all be very challenging. So we need to focus on reducing lifelong dependence and really truly focus on meaningful autonomy and that independence. Your child is seeking that autonomy. You may not realize that they're seeking it because they have autism and they may not express themselves well and they don't socially interact well, but they are truly wanting to be independent and do as society would suggest that they do. You know, that 16-year-old really does want to drive, might be fearful of driving, but really does want to drive. And so we want to make sure that we're giving them the skill set and the tools and helping enhance their confidence so that they can be as successful and independent as possible. Another thing I always like to touch on is just daily living skills. And this is something, parents, that you can even start to do now. If you have a 2-year-old in the home or a 4-year-old in the home, those kids need to have chores, right? Self-care. They need to learn how to take care of themselves. They need to put their clothes in the hamper. They need to make their bed. They need to learn to manage their money and, be able to set the table and do chores beyond themselves. So daily living skills are critical and should start in the home very young, with or without an autism diagnosis, but I don't want the autism diagnosis to give them a get out of jail free card.
It's always something that every time I hear you talk, it's always that same refrain that, with or without an autism diagnosis, children should, be being brought up as children. Same thing, chores, everything, just the same kind of thing all the time, which is great. Parents hear this advice all the time. Let's wait until they're 6, they'll catch up. Every child develops differently. What is the real harm in waiting?
So I want to step back just a minute, Simone. You had talked about these kids really need to have kind of a fighting chance, right? And so our mission here at Amazing Kids is empowering parents with teamwork. Every time I see a child in the office, we're talking about what that child should be doing for a typical developing child. And as a parent with a new child with a diagnosis of autism, sometimes we just don't know what to do. So we let the child kind of run the show. If they don't want to help with the chores, they're not going to help with the chores. But we have to really hold them accountable. And so, parents, I want you to hear this. It starts with you. If you hold your child accountable, who else is going to hold them accountable? They're going to hold themselves accountable and the world's going to hold them accountable. If you allow them to not to get away with things and to not meet the expectations that you have for them, then they're also not going to hold themselves accountable and the world isn't going to. And we're going to treat them like they have autism and not have any expectation of them, which is insane. We have to give these kids the tools so that they can be set up for success. And so, what is the real harm in waiting, Simone? So, I'm going to talk a little bit about the development of our nervous system. So, we have nerve cells, they're called neurons. We all have them, they're all over our body, especially in our brain and our spinal cord. And so, these neurons are known as basically our information messengers. This is how our body communicates from our brain to our spinal cord to the rest of the body and back. So, a 2-year-old has about 50% more connections than an adult. Just process that. That's a lot of connections. 50%.
A lot of connections.
A 2-year-old, right? And so, what do these connections do? Well, what's a 2-year-old doing? They're potty training, they're feeding themselves, they're opening doors, they're climbing anything that they want. I've had lots of parents tell me about their 2-year-olds climbing counters and standing on tables. They're fearless, right? So it's a synaptic explosion. It's the most magnificent circuit board you've ever seen. And during this time, it is an absolute critical period of development, more than any other time in our lives. Children at the age 2 and 3 have a high capacity for change. They learn rapidly, they adapt to their ever-changing environment, and they develop emotional intelligence. So you tell me, is it a missed opportunity? If we're not diagnosing our kids and we're not getting them the tools and the support services that they need as soon as we see symptoms, then absolutely it's a missed opportunity. And what ends up happening is it becomes a cascade of delay in development, behavior, with unfortunate, significant social consequences. So we need to make sure that we're jumping on board and finding a great team to take care of our kiddos and make sure that they're getting these full evaluations in a timely manner. And I do also want to caveat that with it's never too late, right? So ideally, we like to get patients diagnosed between age 2 and 3, but sometimes kids don't really present with a lot of symptoms until they get older because autism is a spectrum. And so, whenever the symptoms are there, and whenever the struggle is there, and whenever the concern is raised, I always recommend a full medical evaluation.
So let's build on that a little bit and let's talk about the elephant in the room and the unintended effects of delayed evaluation. What's at stake when a parent is trying to see developmentally if their child will grow out of behavioral issues, or what may be indicators of early signs of autism?
Yeah, so not diagnosing a child with autism can unfortunately cause some unintended stress. And so if we delay the evaluation, we're going to delay the intensive supports. It's going to increase family stress and uncertainty and widen that disparity for a marginalized group. So there's also the risk of other additional diagnosis. So we kind of use this terminology a lot, which isn't a technical term, but this alphabet soup that kids will come in the office with sometimes. So sometimes I'll see kids and they'll be 13, 14, and they have maybe 5, 6, 7, 8 mental health diagnosis to include self-harm and suicidal ideations. And it's like, oh, well, guess what? This child just had autism. And if we would have looked at that and evaluated the autism at that early age, we could have hopefully prevented all of that mental health distress because autism is social delays and rigid behaviors. And so if socially I'm struggling to interact with the world around me and I have a set way of doing things, I'm never going to meet my own mark. I'm not going to make friends. I'm going to have a hard time interacting. I'm going to have a hard time advocating for myself. And let's face it, it can be very, very lonely and isolating. So, the elephant in the room, we have to address it. We have to take care of these kids. I know it's not easy, parents, but it's the ball's in your court, and we're here to make sure that we're giving you the tools and setting you up for success.
So, adding to that, what would you say to a parent who's afraid that diagnosing their child too early might be put them in a box?
Yeah, so I've heard of that as well. Again, I think that kind of comes back to the stigma, but I would like to kind of shift a little bit that the diagnosis opens the doors. I would say the box truly comes from not diagnosing. And without a name of what's going on, children again are more likely to be misunderstood, punished, bullied for their differences, and expected to fit in a system that wasn't really designed for them. So a diagnosis can help the adults and the child's loved ones like change the environment and adjust the environment instead of trying to really change who the child is. We can give them the right tools and help them get set up for success. So a diagnosis is not a tool. It is a tool and it's not an identity. So your child is the same child that you walk in the office with, that you're leaving with. This diagnosis just helps to make sure that we're going to support your child and support their strengths, protect their mental health, and build skills towards independence. Again, I want your child functioning at the top of their ability. And we got to get that diagnosis acknowledged and the treatment plan in place so that we can help them function at the top of their ability.
So, Dr. Henley, let's get very practical. By the end of this seminar, parents should understand autism assessment so well that they can advocate confidently, even in front of their own doctor. So, let's break it down. What's the difference between a screening, a test, and a comprehensive medical autism evaluation?
Excellent question. And so let's just talk about the screening, right? So when the child goes for routine well visits, usually 18 months and 2 years, their primary care provider should be doing assessments at every well check just to see where the child's development is. But at the 18 months and 2 years, the modified checklist for autism tool is usually the one that's utilized to see if there are any symptoms of autism. We don't really have great screening tools. And to be honest with you, we don't have great diagnostic tests. And the screening tool for the MCHAT, there is a lot of variability with that result. But if that test is positive, then that is a flag that the child really should have a further autism evaluation. Not to say if that test is negative, the child shouldn't have an autism evaluation. If the primary care team has concerns for autism, then the evaluation should occur. So the screening tools are quick tools. They're 15 questions typically, and parents are going to be able to fill them out in a matter of 30 seconds to a minute while they're waiting for their child's medical appointment. The second thing is just an autism test, right? So we have a lot of autism tests. They can be screening tests and they can be diagnostic tests. And so all of these tests are standardized instruments that are created by scientists and researchers, and they try to acquire the information that we need in order to gather more data, right? So when we're doing the medical evaluation, where we're actually seeing the child, evaluating the child, interacting with the child, gathering the full medical history, these tests really augment the clinical evaluation. So here's the big secret, parents. At the end of the day, the autism evaluation is truly a clinical evaluation. There's no test. I can't order a scan, can't order an MRI, CAT scan, I can't order a lab that's going to say your child has autism. That's not the way it works. It's a very complex neurodevelopmental disorder, and every child with autism is completely different. And so I try to simplify it by saying autism is social delays and rigid behaviors, but it's very layered and complex for both those social delays and those rigid behaviors. So we have tools that we use as clinicians. And so really, we have to have the skill set. We have to have the training, we have to have the expertise, and we have to have the exposure to lots and lots and lots of people with autism. And as we gain all of that experience and that exposure, the clinician is truly the asset that you're looking for, someone who has the experience and the confidence to do the diagnosis with utilizing your input as the parent, utilizing the standardized tools, and most importantly, interacting and watching how that child interacts with their loved ones and the world around them. So it is a very layered evaluation. Now, I'll caveat all that to say there is variability from one diagnosing provider to the next. And there's not a standard. There's not one standard that says this is the way you as a clinician have to do your evaluation. It's basically based on the clinician. We have a standard set of tools that most of us will utilize some of those tools, but it really depends on the clinician's experience and confidence with doing the assessments and training that they have completed. And so when you're looking for a provider to do this evaluation, you might have an individual provider, which is perfectly acceptable. And the individual provider could be a primary care provider, such as a pediatrician or a nurse practitioner, could be a psychologist, if psychologist has the additional training, could be a developmental pediatrician, could be a neurologist, could be a psychiatrist. So those are typically your 5 groups of medical experts. And within those 5 groups could be a physician, could be a nurse practitioner, could be a physician assistant, could be a psychologist. So along with the actual medical evaluation, we always recommend, and this is just kind of a side note, is some genetic testing. So we have over 1,000 genes associated with the autism spectrum disorder diagnosis. So it is important for us to do a chromosomal microarray analysis and a Fragile X testing along with the formal diagnosis of autism. So last thing I want to talk about is, again, could be an individual provider that I just listed out, or it could be a team doing the evaluation. One is not necessarily better than the other, because if you're doing an individual provider, you're going to have the team members at some point see your child. The multidisciplinary team is kind of a one-stop shop. So you might have your diagnosing provider with your speech therapist, with your psychologist to do cognitive testing, with your occupational therapist, with a social worker to kind of help you navigate. And so this is whether you have a multidisciplinary team diagnosing your child or you build this team yourself, which you're going to have to do anyway. That as far as the diagnosis goes, you need your diagnosing provider needs to be there to evaluate the child. So there's not a right or wrong. I know it feels a little complicated, but it's important that I wanted to try to explain that so that you understand what a team may look like and the variability of the different teams.
Thanks for that. That was a great comprehensive explanation. So now that you have explained in detail what a good autism evaluation should look like, It is becoming more obvious to me why it is so challenging for parents to obtain an autism evaluation for their child, as it takes a lot of education and training to develop the skill set to evaluate these children, which also increases the cost of the evaluation. Can you talk a little about the nationwide shortage in diagnosing providers?
I can, yes. So there are about 700 developmental pediatricians in the country. So all developmental pediatricians can diagnose autism, and there's about 100 developmental nurse practitioners in the country. So that's 800, and many of the developmental pediatricians are retiring. And so along with that, there are very limited number of psychologists that actually have gone through the training that feel confident to diagnose autism. The American Academy of Pediatrics is definitely encouraging primary care teams to do this diagnosis, but primary care teams are very overwhelmed with all other things primary care, well visits and sick visits. And reality is they have about 20 minutes per patient. And so we are just in very, very short supply. And then I'll caveat all that with most neurologists and psychiatrists do not focus their practice on autism care. You might find onesies and twosies out there, but they focus their practice on other disorders of the brain and bipolar, schizophrenia, multiple personality disorder, whatever their other passions are. But typically, autism doesn't dominate a neurologist or a psychiatrist practice. And so, as a parent, this can feel really confusing because you don't really know where to go. So, it's very common. There's about a 1 to 2 year wait list for children to get autism evaluations. And these evaluations are time intensive. And so, oftentimes in the civilian world, providers decide that they are not going to stay practicing because if you have one no show, you're not getting paid for your services. And so, it really is a major medical problem, and that we here at Amazing Kids are trying to solve this problem. And so I think that'll lead us into our next question, Simone.
Absolutely does. We're going to talk about how Amazing Kids stands apart. Can you go on and explain what makes Amazing Kids autism different from traditional diagnostic models?
Absolutely. So, everything I just talked about, as far as having an evidence based medical evaluation, is hands down what we do here at Amazing Kids. I think the biggest difference is that we have rapid evaluations. So, our goal is to get children in within 72 hours. And that includes parent filling out paperwork, which takes about 2 hours, and having a full comprehensive medical evaluation with a report and results and a treatment plan within 72 hours. What do you think? Can we do it?
I think we can.
The
We
second
love kids.
We do love kids. And the second thing that I want to point out is we are all virtual. So everybody knows the world got turned upside down with COVID. And I thought, how in the world am I going to do these evaluations virtually? I need to get my hands on these kids. I need to see these kids in my office. But we had no choice. We had to transition over to virtual evaluations. And with that, wow, what a blessing. I now have a child in their natural home environment with their own toys, with their family, with their siblings, with their pets. I've met lots and lots of pets, chickens. I had one patient that had 20 chickens and had all of them named, and I got to meet all of them, including Polly, that did not want to come out of the chicken house. And so, what a gift to be able to see a child in their own natural environment, their safe place. They haven't had to get in the car and travel to their appointment. They haven't had to have the stress of noises, sounds, beeping, vital signs. They're just home. They're home doing what they would normally do. And so, virtual healthcare. So, again, comprehensive medical evaluation, speed and access is how we are different. Virtual natural environment is another way that we're different. And then the last thing I just want to point out is it's just clear. We are only diagnosing autism. We are focusing only on autism diagnostics and helping you build your team for your child. So we're going to give you clear, actionable guidance, not just a report, but a plan of action on how you can best support your child and build the best team that you can. This Autism Playbook seminar is going to continue to be available at least once a month. Right now, we're doing it twice a month, and it will be free to anybody who has been seen by us here at Amazing Kids forever. It's something you can come back to at any time. And so that's how we're different. We want to make sure that We are seeing your kids quickly. We want to make sure your child's in their natural home environment, and we want to give you clear, actionable guidance, not just a report, along with our evidence-based evaluation.
So I've heard you talk a lot about diagnosis being fluid, not static. What does that actually mean, and why is that so important for families to understand? How do you help parents adapt in real time as their child's needs change?
So autism diagnosis is truly a spectrum, right? We really got the name pretty spot on. Autism spectrum disorder. So the word autism can be broken up into two different parts, autos and ismos. So autos means self and ismos means a state of being. And these are the Greek roots. So autism is a state of being within oneself. It's not a single condition with a fixed set of symptoms, but a diverse group of neurodevelopmental differences that present uniquely with each person. So there's a lot of variability in the traits, and there's variability in the levels of support that are needed. So with the diagnosis, you get the diagnosis of autism spectrum disorder with a severity level of 1, 2, or 3. And that severity level is strictly based on the level of support that that child needs for that point in time. So it's not something to get hung up on, but today the child might be a level 3. They might be really struggling. As we get interventions going, the hope is that we're going to drop down to a level 1. And then we might hit high school. And guess what? We might drop up to a level 2 or a level 3 again because there's a lot expected of a high schooler. So autism is a consolidation of previous diagnosis. I think we touched on this last seminar as well, but I want to bring it up again. Is that Asperger disorder, pervasive development disorder, those don't exist anymore. Infantile autism and the one I hate the most is low functioning and high functioning autism. Thank goodness that one is gone. We don't diagnose with any of those anymore. Autism spectrum disorder severity level 1, 2, or 3 is a consolidation of all of those diagnoses. And as I said earlier, autism really is linear, and it's not linear. I'm sorry, it's not linear. It's very diverse, and it truly is a spectrum. And it's fluid because these symptoms evolve over time and with development. So as the child matures and grows, we're going to see more of those autism core symptoms. So it's pretty common for me to see like a 2 or 3 year old and diagnose them, and they're kind of happy go lucky. And then we hit 3 and 4, and all of a sudden we're agitated, we're irritable, we're frustrated, we're hitting ourselves in the head, we're biting. And it kind of blindsides parents because you had this happy go lucky little kid, and then all of a sudden those core symptoms are really starting to take shape. And so, again, that's where early diagnosis and early intervention is critical. But these symptoms are fluid and they're going to change with development, they're going to change with the environment. We can have a happy kid at home, but as soon as we transition them to the car, we might see a lot of those core symptoms come out, and life could become really a big struggle for them. So, and as we talked earlier about school, it's not unusual to have a brilliant child, but as soon as they cross that threshold in the school and the sounds and the noises and the fire alarm and all the kids talking and touching them in the hallway could really send them into a challenging position where they basically can't function. And so we have to, again, we diagnose, we give them the interventions, we give them the tools so that as they're growing and maturing, we're addressing all of these needs and making sure that these core autism traits don't dominate them.
Thank you for that. I think the idea of the autism being so fluid is just something that was very new to me when I first started hearing you talk, and so it's really just a fascinating topic. Before we go to question and answers, I thought we would just talk about preparing for the real world. Safety, comfort, and accommodation matter, but so does preparation. How do families balance honoring who their child is today while still preparing them for discomfort, growth, and independence? And at what point does protecting a child become limiting them?
Yeah, so I think it's really important for parents to honor your child today, prepare for the future, and support, not suppress. So we have to have that balance, right? And so we need to reframe. The goal is to keep as many doors open as possible. We want to honor the child today and protect that child's identity and protect that child's mental health. We want to prepare the child for the future, protecting their freedom, their safety, and their independence. And when families can hold both of these together, the children grow up knowing that, hey, I'm awesome. I am accepted as I am. I'm capable of learning, and I'm capable of navigating the world. And you know what? It feels good. It feels good when that kindergartner is able to go to school and able to follow all the rules. They're able to go to circle time, they're able to put their backpack up, they're able to make friends, they get invited to parties. Like it just feels good being a kid. And so we need to hold that close, parents, and we need to recognize your children are amazing. Children are have autism and they are amazing. We need to accept them who we are, but we also need to challenge them as we would challenge every other child to be the best that they can be and to work really hard at that. And so once that combination comes together, they're going to set the world on fire.
Thank you, Dr. Hensley. Your information, you're always so lively and generous and warm. And we're going to open the live Q&A now. Everyone is welcome to turn their cameras on and ask Dr. Hensley questions directly. No question is too small, too emotional, or too practical. You can also put them in the chat if you'd rather not put your video on, but we'd love to see you.
I know somebody's got a question out there.
Someone has to have one.
Once
After
we
all that
start,
great information.
Hi, can you hear me?
yes, we
Yes,
can hear you.
welcome.
Hello.
I am, or actually was, I'm a retired PE teacher. And you were talking about early diagnosis being very important to their future. As being a PE teacher, I see these kids every day. I see them more than I want to say almost their classroom teacher because we see them every day in different environments dealing with socializing with other students, whether it be in their class or with another class because it's large groups that they have to learn how to play by the rules and they don't understand. Kids who are autistic, they don't understand they have to share or they have to have teammates. They want everything just like they want to be the tagger the whole time or they don't want to be a tagger at all. And so as a PE teacher, you have to incorporate everything and everybody and treat them as equals. They're all equals and they're great, but there are a lot of students that are undiagnosed and the teachers don't understand like what's going on with these students. And there are a lot of times we like to talk to parents about what's going on with them socially. And as teachers, we can't legally talk to them about what's going on unless the parent approaches us and asks us how they're doing in the classroom. Like, how would you initiate a contact with the parent and letting them know that things are going on? I guess is what I'm saying.
Yeah, thank you, Lori, for that. So this is the second week we've had educators come on and talk because this is challenging. And as a PE teacher, you want all your kids to be very successful and be able to
Mhm.
participate and have fun. I mean, whenever ever I ask my patients the best part of their school day, it's
Mm.
PE and it's lunch, right?
That's
Right.
right. That's right.
PE and lunch, the two best parts of
Yes.
the day. And
Yes.
so it really does put you in a challenging position. And,
Mm.
and I would say therapists are also put in this similar position because they're not allowed to diagnose either. But
Uh-huh.
you all see kids with autism every single day. And so I think for my parents out there, you have to build the right team. I've seen educators get in trouble for using the word autism. I've seen therapists get fired for using the word
Yes.
autism. I've seen
Yes.
grandparents get fired for using the word autism. And again, I think it comes back to that emotional process and that grieving process that that parent is going through. But if we stay in that grieving process and we never get to acceptance, it's going to be hard for us to put that coach's hat on and build the best team that we can for our child. So I would say as a PE teacher, it's important to again just build that partnership and that trust with that parent, which I know it's hard because you have hundreds and hundreds of kids that you're caring for. But once the parents see that you have a genuine interest in the child, the hope would be that the parent starts to trust you and actually ask your opinion. And then the door
Yes.
is wide open once the parent asks your opinion. But I will say, as a healthcare professional, some parents just are not ready to hear it. And I think that's why it's important for us to talk about the stages of grief and trying to figure out where they are in that process. Because at the end of the day, it doesn't benefit the child at all to not have that full evaluation and diagnosis. But thank you for what you do. I think you
Mhm.
you are amazing and you have served so many kids. I know you said you're retired, but I might be pulling you out of retirement here
Ah.
to help
Well,
advocate.
Well, if there are parents there that are questioning their diagnosis, the best place to ask are the teachers or are the PE teachers, the music teachers, the ones that where they're in group atmosphere. It's just a different atmosphere away from home because sometimes you think at home that everything's okay, but when they get in those schools, there are other things going on and it's hard for them to adjust if they're not given the tools to adjust. So early diagnosis is very important. So
Absolutely. And we're only a kid for such a short period of time, right? So
yes.
we only have 18 years, parents. Like that
Yes.
time comes and goes really quickly. I know it doesn't feel like it when you're in the throes of it, but we have 12 formal years where kids are in an academic environment and that's society for them, right? They're learning how to integrate, they're learning how to advocate, they're learning how to be educated and make friends. And so if we're not giving them the opportunity with the right tools in this safe school environment, then how are they ever going to acclimate to the world and to the job, to the employment, right? And so we have to encourage them to function at the appropriate developmental age. And so without the diagnosis, again, they kind of go through their formative years kind of a little bit with a blinder on until we get to the point of, I mean, I've seen, unfortunately, lots of parents in my office, the kids are 16, 17, 18. All of a sudden, the parents are like, okay, we need the diagnosis. We've known since they've been 2 or 3. And I'm just like,
Mhm.
what did we do? We had all these years, like we could have given them the right intervention, but they were so fearful of the diagnosis that they never moved forward with an evaluation. So thank you, Lori, for coming on and sharing.
Yeah, definitely. And behaviors are huge. I mean, it's a huge sign when you have a lot of behaviors because they don't know how to communicate. But I love when on your first show, when you were first talking, and that parent that came on and said that her son went in front of the class to explain what autism was so that the students understood what was going on in his life. So it helped them accept him more. I thought that was amazing. I mean, that's the way to do it. That was a really, that
Yeah.
was, that was cool.
It
So,
was so empowering for him. And I've had a lot of patients do that, right? And it might be as young as preschool. I've had some explain to their 3 and 4 year old, classmates. So we empower them with the information. So we at Amazing Kids want to empower parents with teamwork so that they can empower their kids,
yeah.
right? Once the
Yep.
kids start taking over like that, forget it. They'll figure it all out within, therapy gets pushed to the side and the kid just figures it out. So
So
such a
it's,
gift.
yeah. Well, thank you. I mean, I just had to put in my 2 cents and
Thank you, Lori. I appreciate
Thank you.
bye bye.
Hello. So you mentioned that at Amazing Kids, it's more than you give the diagnosis, but you also give an actionable plan. Could you elaborate on what you're providing parents at the end of the evaluation? What is this actionable plan? What does it look like?
Excellent question. We haven't talked about that. This is week 5, and we haven't talked about an action
Right. What
plan.
a
This is
good
a great,
question.
great question, Savannah. So, what is an actionable plan? So, an actionable plan is building a team for the child. And so, as a healthcare provider, I'm partnering with the parent to build the best team that we can. So, I'm going to definitely give recommendations for medical resources. So, if a child we'll just say a child's had a lot of ear infections. So the actionable plan might be, hey, we need to go to the otolaryngologist so we can get those ear infections looked at and make sure that we don't need tubes, right? So that might be part of a medical plan. A therapy plan might be, well, our communication isn't where it needs to be, or maybe the child is a teenager and they're speaking very nasally or very monotone. So part of their plan might be to put in for a speech therapy consult so the speech pathologist can see them and start doing therapy with them. Some kids very commonly have feeding struggles and restrictive feeding disorders with autism. And so I might bring in my occupational feeding therapist to start evaluate them and determine what kind of support that they can provide them. So we have your medical experts will be part of the actionable plan. And like another medical expert might be maybe there's concern for seizures for the child. So maybe I'll put in for a neurology consult so they can be evaluated for seizures. So you have your medical experts, you have your therapy experts, and then these other 2 experts are absolutely critical. So we have your community experts and we have your advocacy groups. And so this is the part that I think a lot of us as healthcare professionals forget to talk about with families because medical and therapy, let's face it, they're not cheap, right? It's going to be a lot of expense there to come to get those interventions. But when you engage the community and you engage the advocacy groups, there's free money there. There's money that people have given to support your child. So that would be, getting maybe in an adaptive sports league. That would be Special Olympics. That would be going to the Autism Society and going to their sensory movies that they have. Your child needs to be a kid and the child needs to be around other kids their age. So peer to peer interaction is critical for all kids for development. Peers are not forgiving. right? Those little kids, if I have a 5-year-old with autism and they like to hang out with 2-year-olds, well, guess what? They're bigger and they're taller. So the 2-year-old's usually going to listen to the 5-year-old, right? And if that same 5-year-old is hanging around 7-year-olds or 8-year-olds, the 7 or 8-year-olds are going to be like, he's little, he can say what he wants or do what he wants, right? But when that 5-year-old's around other 5-year-olds and they're out on the soccer field and that 5-year-old is not doing what other players are doing or not paying attention to what his teammates' needs are, those peers are going to hold him accountable to function at his age. So the community is critical. And so I love for kids to get out of therapy and get into the community, just like every other typical kid, right? Kids go to school all day, and then after school, they go to activities, they have family time, we have dinner, right? Whatever our routine is, when we keep putting therapy after therapy in there, then we are eventually going to lose that childhood for that child because they're just in therapy all the time. And so we have to build that team, and every team is very different. And so building a team is going to be about the parent knowing their child and engaging with all these team members and figuring out where that team member should be on the field is critical, and it's going to be fluid. So there's that fluid again. It's going to change depending on what the child's needs are. And so if speech is a big problem, that speech therapist should be on first base. But once that child is engaging and has a method of communication, that speech therapist probably shouldn't be on first base, and maybe we can put that soccer team or band on first base, and that could be the child's core intervention. So great question. We build a comprehensive treatment plan that's actionable. This is what you need to do. This is where we need to assimilate your child and get your child out into the world. And then again, just come into these playbook seminars so they can just continue to gain knowledge and help their child grow and develop. So thank you, Savannah. Did I answer your question thoroughly, or do you have anything else you want to add?
Yes, thank you. That was great.
Thank you. Anybody else have any other questions?
We have time for a few more.
So I see I have Dr. Bienya on. Good morning.
Hi,
Can you-
I'm actually in a very loud place. So, hi everyone. I'm sorry, I don't want to embarrass myself with where I am. So, I will mute unless you want to ask me something specific.
Yeah, I was going to so Dr. Bienya is a clinical psychologist. And so I just wanted to see if you had anything to add. I'm thankful that you were able to join today.
I just want to say thank you for doing this. I think you're doing amazing work for an amazing population. And I've known you for many, many years. And I just am in awe of your current and future endeavors. And I think this is going to open up amazing opportunities for families. So thank you.
Thank you. Thanks for joining. So we'll talk a little bit about, unless somebody has a question, I always like to maximize the time here. So we had a question earlier in the week about if in Amazing Kids, we do cognitive testing, intelligence testing. And so intelligence testing is typically done by a clinical psychologist. And it usually is a test that needs to be done in person. I'm not aware of too many clinical psychologists doing those evaluations virtually, although I'm sure there are some out there. But I always caution parents to not rush to have a intelligence test for their children with autism, especially before a diagnosis. So let me kind of drill down a little bit further on that. So cognitive testing is going to evaluate a child's intelligence and compare it to other children that child's age. So it's very common, unfortunately, that a lot of kids will get school assessments and they get labeled as having an intellectual disability. And clearly, a child doesn't have an intellectual disability. They can take apart a computer and put it back together, right? But for that test, that child's autism core characteristics were so dominant that it was really a struggle for the child to complete the test. And the evaluator determined that they had enough data to support that diagnosis. Typically, it's a school psychologist. And so at some point, your child should have formal IQ testing. When you do that, should be at the best point where that child is really thriving is usually what I recommend. So once the child has gotten the diagnosis, has gotten some interventions, and really starting to function at the top of the child's ability, that's usually when I would move forward with that formal IQ testing. So here at Amazing Kids, we do evaluate. I do some standard measures. And if I do have concerns for cognitive impairment, then it is something that I will address with you as the parent. But it's not something where you're going to walk away from our evaluation and you're going to know my child has, mild, moderate, severe, borderline intellectual ability. But it is an assessment that I do recommend that you get for your child at some point in time, as well as a learning disability assessment. And both of those assessments can usually be done through the school systems. But again, we want to make sure that the child is starting to overcome a lot of the core characteristics and features of autism. So just kind of wanted to add that. If anybody has any questions about psychological testing, psychoeducational testing, or IQ testing, I'm happy to engage those as well. Anybody have any other questions? So here at Amazing Kids, we're also going to be supporting, we are located in Florida. We're going to be supporting some local autism runs. The Doug Flutie 5K on February 21st will be there. And we are also going to be supporting the Brighter, what is it, Simone? Brighter Start 5K?
5K, yes.
In Tampa over
March 15th.
That's
right?
March 15th.
March 15th.
Yep. And then our next Autism Playbook seminar is when? That's
February 25th, I think.
Yep.
Is that right?
And
Is that
that
the Wednesday?
That one is going to be a little bit different. We're not going to do these dialogues as much. We're going to start to interview. Well, that one's going to be interviewing parents, and then colleagues will be on the upcoming months as well. So look for lots of exciting things coming from us here at Amazing Kids.
Thank you, everyone, for joining us today. At Amazing Kids, we believe people with autism are truly amazing. We help families gain clarity sooner because clarity creates confidence and confidence creates forward motion. If today's conversation was helpful, we invite you to explore the Autism Playbook by Dr. Jennifer Hensley, a practical guide to understanding diagnosis, building the right supports, and planning with confidence. And to every parent listening, you are not behind, you are not failing your child, and asking difficult questions and seeking answers early are some of the most loving and powerful things you can do. Thank you for being part of Amazing Kids, empowering parents
with
teamwork. Thank you.
Hey, everyone.
Bye-bye.